This is going to be our last topic in this unit. So we'll do the notes with then a quiz, and then you'll have one assignment that's going to get handed into the Dropbox. Now, I just want to talk about the assignment first. Ordinarily in class, this assignment would take a couple of days, and you would do a presentation and present your patient to the class. What you're going to have is you're going to be assigned a patient number. You're going to look at the pictures or the images of your patient. You're going to look at the medical jargon about your patient, and what you're going to do is rewrite it in layman's terms, or terms that will help somebody who doesn't understand all the medical words. You're going to write it in words that they will understand. There will be more information on the assignment, but I just want to let you know now because I'm going to post it for today, and then you have a whole week to do it. I'm not going to give you any new work on Friday because that'll be your assignment for the new work. All right, so we're going to talk a little bit about cancer terminology because it helps with the assignment. All right, so let's get started. I know I said all right, but I don't feel like restarting. All right. So first term is the term biopsy. Now you may hear or watch on shows where they tell people, okay, you got to go for a biopsy. You may have had a biopsy yourself. There's a bunch of different ways they can do a biopsy. One thing they can do is just scrape the skin off a surface if you've got something kind of odd on the surface of your skin, and then they send it away to be looked at under a microscope. The other thing they can do is a needle biopsy, where they go in with a needle and take some of the cells out, send it away, it gets put onto a slide, and then the technologist takes a look at it. Right, so this basically what we're doing is we want to look at living tissue. And we want to see if we can find the presence of cancer, or if we can see if we can find the cause of the cancer, or we can see the extent of a disease, right? So we may biopsy a couple of spots on the body to see exactly where the disease has extended. So this is a needle biopsy. So there's the tumor, whatever it is that they're interested in. They will stick a big long needle in through the wherever it is on your body, take a couple of these cells out, and then send that away to a lab to be looked at. Right? They can also do it into a bone as well. So that's the first term. We talked about this one already. This will be an easy one for you. So what a radiotracer is. So basically, we're just going to take a radioactive element and link it onto a compound that is normally used in your body. So glucose, water, ammonia, anything like that that your body's going to naturally take up. As soon as we put that radioactive element onto the natural chemical, we now call it a radiotracer, and the person can inhale it. It can be injected or ingested into the body. So this is showing you it being injected in here. The next term is, we talked about this one already, the fluorodeoxyglucose. So we can just, as long as you know it's FDG, you're fine. So this is basically just our glucose with a radioactive tag of fluorine. And we know already that it goes into the parts of the body that use glucose. Well, all the cells are going to use glucose, but it'll be taken up much quickly in areas that use high amounts of glucose. And we talked about this already, how cancerous cells use glucose differently. They just gobble it up really, really quick. So we can use it to show cancers. And you already have this diagram where we show the fluorine there as a substitute to where the OH group would be. This FDG-PET CT scan, so this is telling you that we're going to be using a nuclear scanning using the FDG at the same time as we're doing a PET scan. So all PET scans are the same time we're doing a CAT scan. All PET scans now are PET CT scanner combinations. So it's kind of nice for the patient though, because they only have to go for one scan and you're getting all the information at the same time. So, you know, you'll see a little spot on a CT. This will help you pinpoint where a lesion is detected on a PET scan. So you'll see the term lesion. We'll talk about that in a little bit. So here's just your plain CT scan. This is one where it's attenuated because we've also included, or we've done a PET scan on this, and this is where we fuse the two in here together. Right, so we can see where some of the spots are really glowing versus where they're not glowing. So another term is called staging. You'll hear people talk about cancer and what stage they're in, 1, 2, 3, 4. It could be 1A, 1B, 3A, 3B, what, you know, they kind of divide it into levels. Obviously, the higher the stage, the more serious the cancer is. So what we're going to do is we want to figure out the severity of a person's cancer based on a couple of things. So first off, we want to see how big the original primary tumor is. So the original tumor, how big it is, and if it's like spread out to other adjacent parts of the body around it. All right. So if you've got a tumor in your lung and it's spread out into the ribs that are around that. We also want to find out whether the cancer has spread to other parts of the body. Sometimes what happens with, not sometimes, but a lot of times what happens with cancer cells, because remember, these guys are really sneaky. Little pieces of cancer cells will break off, travel through the body, and then form a secondary tumor somewhere different. And it's really important to stage your cancer because it helps you choose the right treatment and also helps you estimate prognosis. So if you find someone's got cancer in stage 1, so for example, head and neck cancer, if they find it quickly and you're just in stage 1, well, the prognosis is really good. You can probably treat it, get rid of it, live a long, happy life, versus waiting till later and it's spread all over the body and you're stage 4, that would be a worse prognosis. So here's a PET scan with somebody who's had nodules all over the place, all right? So this person would have a greater stage of cancer. Now, another term that's used is restaging. So basically what we're going to be doing here is going back after we've done treatment and seeing how the cancer has regressed. So find the extent of the cancer after treatment. So this is kind of a neat picture. So this person's had cancer. We've got hot spots here. We've got some here. It looks like we got a couple up here as well. And if we look at the after picture, after treatment, we see the hot spots are gone from here, not here anymore, and not here anymore. So this would be the person's restaging, and they would find that a lot of those hot spots have disappeared. Another term you might hear is resection. So this is, especially things like bowel cancer, what's going to happen here is they're going to remove a part of an organ or some tissue. So they're not going to remove the whole entire organ, they're going to remove a piece of it. The example I have here is if somebody has bowel cancer. So what you can do here, if somebody has bowel cancer, they might snip this whole section off, right, and then rejoin it here. That's been a bowel resection. So they remove part of a tissue or an organ. Sometimes they'll do a liver resection or a lung resection. They'll take a piece out rather than the whole entire organ. Metastasis, right? This is a word that gives me a heck of a time to say. But basically what metastasis means is a little piece of the cancer has spread to other parts that are not adjacent. So if you have lung cancer and then they do some staging and they see that you have cancer in your bowels or in your bones or something like that, that would be secondary tumors that have formed because a little piece of the cancer cells have broken off, all right? So the spread of cancer from one tissue to another non-adjacent part. We call those new cancers our secondary tumors. Those little cells have broken off and they've lodged in other parts of the body. And we call those new occurrences metastases, or short form just call them METs. I had a heck of a time yesterday trying to make sure I was pronouncing that properly, and I'm like, oh my God, I'm just going to call them METs. So what can happen is these little sneaky cancer cells can break off, travel through the bloodstream, travel out of the bloodstream and into another area of the body. When they do things like surgery, a lot of times they'll take a lot of the healthy tissue from around the tumors out as well, because they don't want to leave one little speck of one little cell around, and they have to be really careful when they're removing the tumor that they don't accidentally drop some little cells when they're removing it, because they can stay alive and then, you know, infect somebody. All right, so some of the terms of cancer. So one of the terms is carcinoma. So a carcinoma is any type of cell that arises in epithelial tissue. And epithelial tissue is any tissue that lines organs or parts of the body. So it can be the epithelial tissue of the skin, it can be the lining of your internal organs, or it can be so example, any part of the lining of your mouth or your esophagus or your stomach. So your skin, your lungs, your breast, the pancreas, or any other organs and glands. So here's an example of, this is obviously great epithelial tissue, and here's a big example of somebody with some mouth cancer that's happening there. A sarcoma is a cancer that happens, if those of you who've taken kinesiology or your biology, remember a sarcomere is the unit of a muscle. So this is going to be a cancer that arises in connective tissue such as muscle or fat or cartilage. Now it rarely happens in cartilage, but it can happen. So this is a cancer that's arisen in the muscle. Another type of cancer that can form is called lymphoma. And with a lymphoma, what you have is a cancer of the lymphocytes. Now, lymphocytes we'll talk about when we get into our next section when we talk about heart and blood. So lymphoma is going to be a cancer of the lymphocytes. So it's a certain type of white blood cell. Right? And your lymphocytes are found all over your body. You have a whole lymphatic system that is important for fighting off disease, and you have lymph nodes all the way through your lymphatic system. And you've probably noticed some of your lymph nodes when you've been sick. You'll feel them swollen in your neck, sometimes in your armpits as well. Hopefully you're just fighting off a disease. Hopefully it's not cancerous. Leukemia. So our next one are leukemia, which is basically a cancer of the blood. So here we're talking about blood, right? And how blood arises in the marrow of the bone. Now a melanoma. Melanoma is a cancer that forms in the pigment producing tissues of the skin. So skin cancer would be a sarcoma because it's going to be in the epithelial lining, where melanoma is going to be a cancer that arises deep within the layers of the skin in those cells that produce the pigment. So this is a little bit more serious. So if you ever see a mole on your body, they have the ABC so that they have a nice straight border, that the color is normal, versus something that's changing color, has a variety of color in it, and it's spreading. That would be the difference between a benign and malignant mole. Now, another term is called palliative care. So, and I'm giving you all these terms because these are going to come up when you're doing your patients. So palliative care is an area of healthcare that focuses on a couple things. So usually if you end up going into palliative care, it's end of life care. So we want to make sure that when that person's at end of life, they are not suffering. They're not being left alone. There's somebody that's there with them to relieve their suffering. So we want to make sure it relieves and prevents the suffering of patients. The house in North Bay that they've been doing a lot of fundraising for is one such place where you can go there for end-of-life care. Chemotherapy, term you hear all the time. So this is a little bit about how different cancers can be treated. So chemotherapy are going to use chemicals that are toxic to cells. Now, chemotherapy is going to be toxic to all cells, cancer cells and non-cancer cells. But the bad thing, if you remember about cancer cells again, is they multiply really, really quickly. So if you time your chemotherapy properly, you can get the chemotherapy to only kill those rapidly multiplying cells. They won't touch the other cells because they're not rapidly multiplying. They're not as busy. Chemotherapy a lot of times will target hair cells because they are producing hair all the time, which is why in some types of chemotherapy people lose their hair. It doesn't happen with all types of chemotherapy, but it does happen with some types. So this is basically using any types of chemicals to kill cancer cells, but it will also kill normal cells. All right, there's a whole pile of different ways that we can kill off the cells. Now, chemotherapy, you can have injections of it. You can just take regular pills for it as well. It's not always this harrowing thing at the hospital, right? It can be quite harrowing though. So there's different ways that chemotherapy works, and a lot of times if you're going to get cancer treatment, they will give you a variety of chemotherapy. And a lot of times also includes steroids, because the steroids just help you kind of deal with all the effects of chemotherapy as well. But we can use chemotherapy that's going to prevent the growth of blood vessels. Cancer cells, sneaky again, they will send signals out to your body that say, grow blood cells into me. So blood cells will grow into those tumors to make sure that they are supplied with lots of oxygen and lots of glucose. If anyone's ever had a wart cut off, you know that they bleed quite a lot afterwards. That's because there's blood vessels going in there. So the same type of thing for cancer cells. The other thing we can do is we can use our chemicals to stop cell division. If you remember, for cell division in animal cells, you need to have those spindle fibers that form. So one of the cancer drugs that's called vincristine that they found in the Madagascar periwinkle will actually prevent those spindle fibers from forming properly. So it will prevent the cancer cells from dividing properly, but it also prevents regular cells from dividing properly. So you have to time it properly so it only hits the cancer cells, or mostly hits the cancer cells. You can also use chemotherapy that causes spontaneous cell death. It just goes in there and kills off those cancer cells. And you can also have chemotherapy that changes the cell structure so it can't multiply properly. So when people say, oh, you know, garlic or ginseng or I don't know, CBD oil kills cancer cells, it's the only thing you need, and chemotherapy is, you know, just big pharma trying to make money, which isn't true in Canada. You have to keep in mind that the combination of chemotherapy is the thing that works, and no one drug will work, and different cancers have to have different types of treatment. So you can't, one treatment does not fit all cancers. And you can actually have one type of cancer, have chemotherapy for that, and then develop a completely different type of cancer, not because your original cancer broke off and formed cancer somewhere. You can just form a totally different type of cancer that has nothing to do with the original cancer. And you'd think like, man, I already did chemotherapy, you think I could kill those cells off, but no, you have to go get a whole different type of treatment. Another type of treatment we can use for killing off cancer cells is radiation therapy. So what we're going to use is we're going to use those gamma rays and make sure we specifically hit it to a specific spot. So this person is probably getting radiation therapy on a brain tumor. What they will do is they do a measurement, and then you have this wire mesh so that every time you go for radiation therapy, you cannot move out of this mask at all. Like it holds you down, and they adjust the laser to hit just that tumor. Other places where you get radiation therapy, they'll do a little mark, a little tattoo, so they always know where to aim the radiation therapy. Okay, so we're going to be using gamma rays to control, so we can just kind of like keep them at bay or just outright kill malignant cells. Now, also, you're killing cells, and you know, you think, okay, no big deal, but your body has to deal with those dead cells. So a lot of times the side effects from chemotherapy or radiation therapy or whatever type of therapy is just your body having to break down those dead cells. So you get kind of a side effects from your body getting rid of those cells that the chemotherapy or radiation therapy treated. Right? And I should say you can also have surgery to remove tumors as well. Remission. So a lot of times with remission, they'll say you're in remission if you've had so long after cancer treatment where there is no sign of disease. But different types of cancers have different remission. So it's the decrease in or the disappearance of signs or symptoms of cancer, and different cancers have different amounts of time that you have to have no evidence of disease. No evidence of disease, its short form is NED, if you come across that at all. So just so you know that. So this person had, look at all the hot spots in here, had treatment in here, and is now considered to be in remission. A lesion. So a lesion is any abnormal. So if they say, oh, this person has a lesion, it's anything that's kind of an abnormal change in tissue. All right. So it doesn't necessarily mean it's cancerous. It just means there's a little spot that's a little bit weird. So they'll call that a lesion. A nodule is going to be sort of like a little bump or a little thing that kind of forms underneath your skin, a little growth that forms underneath the skin, like not a pimple, but a little growth that forms underneath the skin. So they'll say that's something like a nodule. And then the last term that we need to take for today is this term called foci. And this basically is just a little, this is just a terminology that they would use to say there's a little cluster of cells. So on this thing here, they say, oh, the hyperintense foci are indicated by the arrows. So that would mean this little area here that has a lot of busy cells. This here that has a lot of busy cells. This has a lot of busy cells. So instead of just saying, oh, little area, busy cells, they'll say the foci. So a little area where there's maybe the location of a cancer. They'll call that a foci. All right, so make sure you do the quiz on it. It's going to be just all these terms, obviously, and make sure you read the instructions for the assignment so you don't make it more complicated than it has to be. Alrighty, talk to you later.